At the heart of every successful organization lies an amazing group of dedicated, caring, and valued sponsors.
iCAN is the International Children's Advisory Network, and we focus on advocating for pediatric children living with chronic illnesses.
I joined iCAN so I can become an advocate for other kids facing medical challenges, as I myself have become an avid self-advocate in managing my disease.
The strength of iCAN comes from the support and willingness to help our young people as they learn to share their voices and expertise locally, regionally, nationally, and globally.
The kids have been amazing in joining our webinars to share insight about their clinical trial experience amidst COVID, what works, what doesn't, what is needed, where are there gaps.
iCAN grants me and every youth to have a voice.
By bringing the pharma companies, the clinical research organisations and investigators together with the young people, they can see how they can add value to the trials. By making the trials more patient-centred and more acceptable to children and families, then we have a better recruitment to clinical trials. And recruitment to clinical trials at the end of the day is a target we're all trying to achieve.
I joined the International Children's Advisory Network as a pathway to share my voice to help improve pediatric healthcare.
As a sponsoring partner of iCAN, you will be connected throughout our global consortium of youth, families, caregivers, providers, hospitals, and pediatric support organizations.
In February, we conducted a workshop on the evolving role of artificial intelligence in radiological imaging. Two iCAN members, a teen and her mother, shared their valuable perspectives on this topic. Their input raised design considerations for device developers who were also in attendance.
Our unique approach brings together stakeholders from around the world in an effort to provide a greater global reach for the pediatric patient voice.
Industries and researchers can contact patients, organizations, and young persons advisory groups to co-create and co-design clinical trials with patient engagement activities. This is a win-win approach, good for the trial and good for all the trials.
We've had the luxury, the pleasure of doing multiple focus groups globally. We've gotten a wonderful amount of feedback from different kids across the world. Kids living with chronic conditions, and the idea of getting the insights, getting that input from kids is hugely important. So we are in no way slowing down.
We also have a seal of approval. So once our kids have given you their input on whatever you're trying to build or put together, then you can show that it's kid reviewed and kid approved.
Sponsorship funding goes towards getting our youth where they need to be to share their stories. Our kids are our future, and they are committed to bettering our world.
iCAN is not just an organization, but a community of children where each individual, no matter the location, can be heard.
My hope for the future is that this platform will be able to expand and not only give me the opportunity to explain things that I feel comfortable with and I'd like to change, but to also expand that to other patients and give them a voice.
Your support helps to create the next generation of leaders, doctors, researchers, innovators, advocates, and even your future colleagues. We invite you to look at our sponsor package today to see all of the ways that iCAN can work with you. Thank you.